Excellent. And here we are, week 7, the lymphatic system live chat, brought to you by Central Carolina Technical College. Okay, so it is important and being excited to learn about everything because there is so much. And, interestingly, as you're learning medical terminology, which is a process. Okay, I heard somebody told me about somebody who said, "Well, what are these students learning in medical terminology class?" I mentioned a word and they didn't even know what it meant. And I was like, "Well, this is not something that you learn like that. It's a whole new language." And just like you wouldn't expect to become proficient in French or Spanish or Greek in a matter of 16 weeks. This is more so because you're not using it every day. Although I do highly suggest that you use it in conversations with your friends and family. Okay. So, you never know when it can come in handy. Are you having a the the sunlight? Okay. Did you see that video of the guy who had a squirrel in his home office? And he was
Yes, I have had 3 squirrels. So,
Oh, wow, you are an
yes,
overachiever, that's for sure.
yes.
Okay. That's it. As you kept looking behind you, I was like a little concerned. I wonder if there's a squirrel in her office. Okay.
No, these are the dogs. There's people
Uh,
doing work next door and they're going nuts.
Nuts. Yes. Well, that's all I have are Yorkshire Terriers. So yes, ditto. All right. So back to the lymphatic system, which dogs definitely also have. And I'm not sure about squirrels. I have to admit, and I always admit when I don't know something, I am not up to speed on the anatomical evolution of the squirrel. But see, now I have I actually, what I was going to say before is one thing that I love about healthcare is there's always something new to learn. It is definitely not boring. And so therefore, and it always comes back to applying to us ourselves. So let's get started. What do you say? Look at this. There's lymphatic thingamabobs all over the body. You see that? And the thingamabobs are actually called nodes. And basically, these nodes are little pockets, and they essentially work like filters to pull out bad stuff. And that's why it gets so dangerous when they are affected by a pathogen. Okay. Also, as you can see, they are systemic, meaning they basically they literally affect every aspect of the body and they're all connected. So that becomes very dangerous. The good news is if you know anybody who has breast cancer or had maybe 20, 30 years ago, if the cancer, the malignancy metastasized into the lymph nodes, usually first found in the axillary lymph nodes right here, because of the proximity, okay? That used to be a death sentence, and it is no longer. They now have ways to treat that, so, which, it's absolutely amazing what our health system, what our healthcare professionals have been able to accomplish over the last 50, 60 years. It truly is amazing when you can see something, a condition, a diagnosis that used to be an absolute death sentence, that now breast cancer, 95% survival rate. Used to be 100% death rate. Now it's 100%, 95% survival rate. You can't hear anything. Oh, well, try. Oh, I can't. I can't tell her to log off because she won't hear me. Okay, try logging off and back in again. Okay. All right. So, the as you will note, the lymph nodes as they go throughout the body are essentially named based on where they're located. Okay, so the palatine tonsil, for example, which is a lymph node, and you may have heard about tonsillitis, right? That's an infection of the palatine tonsils, which are hair, okay, where your palate is. Do you remember when we talked about the mouth and all the pieces, parts of the mouth, and you have your soft palate and your hard palate? Okay, well, that's where that name comes from. The palatine tonsil is right back there by the soft palate. So that can help you remember not only the term, but also remember where in the body it's located. Okay, the cervical lymph nodes, cervical spine. Remember, we talked about that when we talked about the skeletal system. Your cervical vertebrae are right here. It's what connects the torso to the head and the brain. So that helps you with that. Axillary lymph nodes, also known as the pit, the armpit right here. But as you can see in the illustration, they're not just here, they're here. So for women, this encompasses the side of the breast, okay, which is why. Okay, so the fact that this is working throughout the body and helping to control the biochemicals as they travel through the body. Okay, all right. Look at how cute the lymph node is. It could be a character in a cartoon series. That's what we should do. Anybody know how to draw? Okay. I don't see any hands going up, so we'll just put that aside for now. Maybe we'll discuss it with the graphic design department at CCTC. Okay, so basically, as I said, the lymph nodes are a filtering system. So they have incoming lymph, which is a biochemical that is traveling through your body. All right, it's going to, and you can see here in the center where it interacts with arteries and veins, because that's part of the channeling. And then after it's filtered, it goes back out a lymph vessel to continue on its way. Okay, and again, as you look at the network, you can see that these lymph nodes are named for their anatomical location. So this gives you a reinforcement of those terms that you learned about the different locations in the body, like thoracic lymph nodes in the center of the torso. Right here, this is your torso. Okay, and then you have your abdominal, mesenteric, and lumbar. Do you remember that from the section of the spine? Again, the lumbar vertebrae start right about here at your waist and go down. The iliac, the pelvic lymph nodes, and remember we talked about ilia and ilia, right? ILIA and ILEA. E, the end of the small intestine, the digestive system. ILIA, a pelvic bone, the skeletal system. And again, this is right there is a whole assembly of lymph nodes, and they tend to cluster together. Okay. All right. Oh, how exciting this is, the lymphatic system. Now, here in your neck, the thymus gland. The thymus gland, and you can see here in the illustration, the thymus is here at the base of the trachea. The trachea leads to where? Who can tell me? The respiratory system. Where the esophagus, the other tube that's going down here, is going to your stomach. Okay, so the thymus gland, part of the endocrine system, is located near the trachea as it is entering the lungs. So that's right about here, right about that notch. Okay, can you feel your notch? The thymus creates hormones that encourage T or thymus lymphocyte production. Very important. If you are uncertain what hormones do to the human body, all you need to do is talk with a preteen or teenager or a woman in her 40s to 50s. I call menopause the puberty the sequel. Okay. All right, I know I've had better jokes. What can I say? All right, and of course, these provide immune defenses to fight off those pathogens. So, and the thymus is nicely tucked and protected right there by the lungs at the bottom of the trachea. So hopefully it can hide from nothing because everything in your body is connected, right? Okay, so you have your larynx, also known as your voice box, your thyroid gland surrounded by your parathyroid gland, with the trachea coming right down in the middle, the thymus, which is also around the trachea as it enters the lungs, and the bronchial tree. Remember the bronchial tree, the bronchi? Right. Okay. So what I want you to remember is you see how not only is everything connected, but it all works in harmony with each other, which is why sometimes signs and symptoms can seem so off-put with what they are actually identifying as the problem. Does your thymus mess up if you have an endocrine disorder? Possibly, because the thymus is part of the endocrine system. An endocrine disorder can be any number of things. So you could have a thyroid issue, you could have a problem with your thymus, you could have a problem with your spleen. Any number of locations within the endocrine system. So endocrine disorder is like saying you have a cardiovascular issue. That it's a whole system. There's no way of knowing what particular is in order or not in order, I should say. So there's you would need to have testing done to find out and pinpoint what the issue is and then address that directly. But it's all connected, so it's perfectly possible. That doesn't help, I know, but that's, this is one of the incredible things about human anatomy that is so fantastic, is all of these parts all fit into this space and each have their own specific thing, but yet this is the greatest example of teamwork when it works and when it doesn't work. Okay, which is important to get your preventive checkups. Okay. The spleen, again, is a filter, only it filters the blood in the same way that the lymph nodes filter lymph. So we have lymph is a fluid, a bodily fluid that's flowing through the body. The spleen is part of the system, but it particularly, its job is to filter blood. However, a human being can live without a spleen, as you may have seen on any number of doctor shows on television. Okay. White pulp, it contains white pulp, which contains lymphocytes. Remember, as you're learning, right? Lymph, the root term relating to lymph, the biological fluid, and cytes, C-Y-T-E-S, refers to cells. So we have lymph cells in the white pulp that attack infectious organisms. This is a main function of your immune system. Okay. And then the red pulp, also lymphocytes and macrophages, which clean out cellular debris. So your macrophages are your cleaning crew. Isn't that nice? If only they could clean my house the way they clean my red pulp. I don't know. All right. I think I need a cup of coffee. All right. Tonsils and adenoids. I am sure you have heard about tonsillitis if you have not experienced it yourself or know somebody who has experienced it. These are technically, and I think we did talk about it when we talked about, I don't think we talked about the digestive system yet. And anyway, tonsils and adenoids are okay? They're officially part of the digestive system, but they are masses of lymphatic tissue. So are they part of the lymphatic system, or are they part of the digestive system? They're two mints in one, and you all are too young to know what that was. It used to be a TV commercial. Okay, tonsils on the back side. Remember I said they're part attached to your soft palate. These are the palatine tonsils. All right, and then your adenoids, which are right there down in the center on top or behind your uvula, behind the uvula, which is that thing that's hanging down in the back of your throat. Okay. They're all tiny masses of lymphatic tissue, and their job is to trap pathogens, both bacteria and virus, and pass them to the tonsillar lymph nodes to be eliminated. If that gets blocked, or for some reason doesn't happen, that's when you get that backup that becomes tonsillitis or adenoiditis and may require the removal of these little pieces of lymphatic tissue. So that's a good thing, you know, if you have a child or a relative who's going in for a tonsillectomy, you can engage the physician and say, so doctor, what do you think? Are the tonsils part of the digestive system or the lymphatic system? Or are they two in one? We don't care, they're getting out. Okay. All right, so I thought it was time for you to take a look at actual physician notes. This is actual physician documentation that was written by an actual physician. And I wanted you to see firsthand how you will be using your knowledge of medical terminology in your future career. Okay, because I think that sometimes some people feel like they're just stuck in this class being told to memorize these words, And as not so much if you're going into nursing or medical assisting, because that could be pretty straightforward, but anybody who is going into health information management or coding and billing may say, why do I need to know this? And this is exactly why you need to know this, because physicians use medical terminology in their documentation, and you need to be able to interpret it and know what they're talking about so that you can interpret it into coding language. Okay. So malaise, can anybody tell me what malaise is? Fatigue. Overall, I'm too tired to do anything. You probably felt it if you had the flu or maybe even COVID, where, you know, really lying on the couch or in bed is almost too much of an activity for you. Okay, so it's general fatigue is malaise. Okay. Um, and you'll notice that the physician also wrote shivering and vague pains in her legs. Okay, so we have regular English because you understand what shivering is. Ooh, okay, and pains, vague, you may have even felt vague pains. You know, it kind of comes and goes, whatever. I can't describe it. Okay, but now we come back to the vital signs. The patient is febrile. Now here you show in parentheses, a patient has a temperature of 104.36 degrees Fahrenheit. Febrile is the medical term for having a fever. It means the patient has a fever. Now you may say, well, why don't they just write that she has a fever? Because medical terminology, yes. And because medical terminology mostly encompasses a great deal more. And this is to become more descriptive in less words, in less time, and more directly connected. Okay, so we also see that the patient is tachycardic. Now, if you remember when we talked last week about the cardiovascular system, we talked about the normal heartbeat of being 60 beats per minute. So if you remember that, then that kind of tells you if the patient is at 140 per minute, what is the definition of tachycardic? And that is fast, 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 fast. Right. That is just like, and again, if any of you are into cars or just have a base on your dashboard of your car, in addition to in addition to your speedometer, which tells you how fast you're going and to slow down before you get a ticket, you also have a tachometer. T-A-C-H, tachometer, which measures how fast your engine is running. So tach means fast. Tachycardic means rapid heart. You see what you're learning? You see, you don't even know how smart you are. Okay, bilateral, two sides, both the right side and the left side. In this case, cervical lymphadenopathy, yeah, okay. Cervical, this cervix. Now, you know, women have two cervixes, right? Yes. Okay. Now, the reason for that is because the word cervix actually in Latin or Greek, it could be, means neck. Isn't that weird? Okay. So neck, cervix, neck. All right. Lymph node, pathy, something is wrong. You see how you can use these parts, the prefixes, the roots, and the suffixes to figure out what a word means until you can get to your medical dictionary. and then confirm or correct. Okay. All right. So we have the pharynx. You know where that is, right? Tonsils, buccal mucosa. And buccal is something that maybe you weren't even aware of before 2020 when COVID hit and everybody had to take a buccal swab, right? I know they did the one up your nose, but a buccal swab inside of your cheek. Buccal mucosa meaning mucus, those white spots. Okay. Red inflamed tonsils are studded with white areas of exudate. Does that sound gross? Because it is gross. It's stuff. White stuff exuding. You know that word, exuding. Okay. So a throat swab is taken before starting antibiotics, and that is because the throat swab is a test, a pathological test that will confirm whether the tonsillitis is bacterial or viral. In any case where there is a pathogen, there must be a test, a pathology test, to determine which of the pathogens, bacterial, viral, fungal, it may be. It's the only way to ensure an effective treatment plan. So the throat swab was taken. We confirm that this is bacterial and antibiotics is the solution. Yay! And a 4-year-old gets to go have ice cream and go home. Yay! Okay, so I hope this gives you a little more insight into why we are teaching this to you and spending so much time reviewing what these words mean and how they relate to the different portions of the anatomy, so that you can put two and two together to actually get 4 instead of 22, because 22 would be wrong. Okay. All right. IVF, in vitro fertilization. What does that have to do with antibiotics? Antibiotics. Okay, that I thought so. I thought it was a typo because I never heard of in vitro fertilization and IV antibiotics. It doesn't say how the antibiotics were administered, but good point, Rochelle, is in reality, you would need to know the 5 rights of medication. Okay, here we don't even have a specific antibiotic mentioned, but you would have the 5 rights of medication administration: the right patient, the right time, or as I call the right frequency, the right medication, the right dosage, and the right something that I forgot now. What is it? Right patient, right medication, right time. Oh, and right route. That's exactly why I started that whole thing. And right route. So IV intravenous. Okay. It could be arterial. It could be intrathoracic. It could be oral. It could be there's lots of ways to get medication into a human being. Okay. So yes, but obviously that would be another part of that would be in the physician's orders, is the specific antibiotic, the specific route. And yes, I would imagine because she's already in the hospital, they probably would give her antibiotics intravenously and then follow up with oral antibiotics for probably at least 10 days when she's discharged. Good, good. And let's keep the obstetrician out of it. But that But you know what, Rochelle, that is excellent. I mean, we all are humans, human, yes, make mistakes. But the fact is that it's an excellent example of the contradiction that we all face in working in healthcare. And that contradiction is humans make errors. And the fact that healthcare requires every one of us, no matter what your job is, whether you're on the clinical side or the administrative side, mistakes can cause harm to a patient. And so we're all part of the same team, a team that requires perfection, which is something that's antithetical to a human being. Okay. Oh, a high fever like that. She's asking, if you all can't see, I don't know if you can see this or not, but how would the high heart rate be due to a high fever? It's honestly, I would say the high heart rate is she's scared and nervous. I would believe the high heart rate would be emotionally caused as opposed to biologically caused. And who wouldn't be? Yikes. And she's 4 years old. Of course, she's scared to death. So I would, without any other information, I would align the fact that she's tachycardic to her nerves, her emotional state. But the other reason, first of all, the other reason it needs to be documented is you certainly want to make sure that she's not given any medication that might increase heart rate as a side effect, which to a person with a normal heart rate may, so we go from 60 to 75. I mean, it's not a big deal. But if you have somebody who's already at 140 and it increases her to 160, that could be very dangerous for this tiny little body. So, and that brings me to another excellent thank you, Rochelle, is not everything in the documentation is focused on one singular thing. Okay. Basically, the documentation needs to provide a full picture of what is going on with this human body. Everything, whether it's related or not related, we need to know about it, because at some point something might intersect. Like I said, they might want to give her IV antibiotic that is known to have to increase heart rate. And like I said, for somebody who's at 60 beats per minute, going to 75, no big deal. They might feel, oh, the doctor is kind of cute. Okay, they beat my heart. Okay, but when you have a 4-year-old who's already at 140, we must be very careful not to provide any therapies that might increase that heart rate, because that would cause cardiac damage. And then we're going to add that to the problems with her bacterial infection. And you know what? This happens because sadly we're forced to work with human beings, and doctors, even with all their education, doctors are human too, darn it. Which is also another reason why you all need to have this education and understand the words, understand what's going on with the patient, because we're part of the team with the doctor. The doctor may be the quarterback or the captain, but the fact is that without the whole team keeping eye, not everything might be caught in the heat of the moment. So we have to give the backup and say, doctor, did you notice this patient is tachycardic? We can't give that particular antibiotic. Okay. Or whatever the case may be. And you should never be afraid to speak up in a very polite and respectful manner, of course. And that, of course, includes the coding and billing sector and those in the HIM department, because those in the HIM department also have the training in anatomy, physiology, medical terminology, and clinical documentation to be able to be the backup and say, oh, wait, did you mean this instead of that? Or what is querying? We call that querying. Querying the physician is mandated by federal law for health information management professionals, coding and billing professionals, okay? And for those of you going into nursing and medical assisting, you need to speak up because sometimes it takes a backup team, okay? Because there's always so much going on. And it's really good to have that extra set of eyes and ears, okay? I just saw, I am a big, huge fan of Law and Order, going all the way back to 1990 when I was just a little girl. No, I wasn't. But anyway, I was watching a rerun, and this girl her father brought her into the emergency room. She was a teenager, and she just needed some antibiotics because she had a sore throat. They thought she had strep throat. Strep throat, okay? And she died. And she died because the physician in charge did not read her chart, her registration form, to see that she was on this medication, and he gave her another medication that was contraindicated, and it stopped her heart dead. Right. Okay. So that was the whole investigation. But the ensuing investigation is, so they're talking to these residents, you know, doctors in training and nurses and everybody who was around, and they're all saying, well, you never question Dr. So-and-so, he's the chief, I don't want to get fired. And so I know it's hard. I know it's hard. But there's got to be somebody whose sleeve you can tug and say, I noticed this, tell me if I'm wrong. Okay. But also think, and I want you to think hard as you enter this world of healthcare. Think about how you would feel if you noticed something, did not say anything because you thought, well, I'm just a medical coder, I'm just a nursing assistant, I'm just a nurse. Okay, which I don't believe the word just belongs anywhere, but what I'm saying is, you know, people say that to themselves, is I have no right to question the doctor. I'm not telling you to question the doctor. I'm just telling you to say, excuse me, I just noticed this. Is this something we should be paying attention? Something. Okay. Think about how you would feel if you noticed it, you said nothing, and the patient died. Because people forget that no matter where in the building you work in healthcare, you are a contributing factor toward the health and well-being of every patient that crosses the threshold. You are part of the team. You are being educated. All I'm asking you to do is use your education. You're acquiring knowledge for a reason, and this is knowledge. You may not understand it now, or hopefully after this little conversation, you know, you understand it a little better. That would be good, because I have heard people say, well, I'm just the medical coder, I'm on the administration side, I just, you know, I just do registrations, I just, you know, fill out a form. You have a functional brain, you have functional eyes, you gotta say something. And there's got to be somebody who you can talk to and feel not so threatening and just say, I'm concerned. Okay. Raise the flag. But don't be a contributing factor into why somebody died prematurely. Because that's gonna be something that sticks in your craw. And in case any of you did not know, this is your craw. Okay. All right. I know. Not too funny jokes and then serious talk about people dying. Oh my gosh. But this is why you must review this information often and builds that knowledge in your brain. Use that medical dictionary. It's not cheating, it's working smarter. And query me whenever necessary. I want you to practice querying, okay? So I am a doctor. I'm not a medical doctor. I'm a PhD doctor, but still, you could practice querying me, okay? Doesn't that sound like fun? And when you want to query me, you're going to query me at safiansc@cctech.edu. Yes, you are. Yes, you are. Yes, you are. The email that is in class list is wrong, wrong, very wrong. And that email will go to the third ring of Saturn, and I will never see it. It is, yes. Okay, you wondered why Saturn has 7 rings? Okay, well, one is lost luggage. I think they may be up to 2 for lost luggage. Then you have lost email. See, the third ring of Saturn. Okay, just ask Neil Tyson deGrasse, or deGrasse Tyson. I love that guy, but I can never remember his name. All right. Okay, did I respond? Well, then please check and make sure you send it to Safian SC, because I was in my email just right before we came in here, and every email that was sent to me had been responded to. So I'm thinking you didn't send it to the correct email address. Could you try again, please? Because I'd be happy to help you. And I don't know what OI is. If it's oi is spelled OY, which is a Yiddish expression, and also, oh, osteoimperfecta. Okay. All right. Well, if you will please double check this on the screen is my email. And I did get emails today, so I know that's working. Okay. So can you try again? And just be very careful. SAFIANSC. Okay. Thank you. I appreciate it. And your questions were great today. Thank you all for joining me. I appreciate it. I will be posting the recording very soon in a course room near you that's called AHS 102, just in case you're wondering. All right. Have a great day. Bye.